So I'm here to introduce Dr. Goldblatt. She's one of the founding members of the Academic Collaborative Integrative Health, which is and is Vice President for Academic Affairs at the University of Western States. And she'll be introducing the next speakers.
Okay, good afternoon. I know it's a little late, and I was just thinking about, do people remember the Peanuts cartoon with a young child raising his or her hand saying, "May I please be excused, my brain is full"? Doesn't it feel, I see a few hands going up, right. So we're going to shift now this afternoon to the whole issue of education and training, and we've heard a number of comments about this area during the during today's talks. But first, I want to do a little bit of interaction, because I always think that's good to kind of get the chi or the energy going a little bit in the afternoon. Does anyone know an acronym? It's relatively new that we developed at the Global Forum for Innovations for Health Professional Education, which is one of the co-sponsors, and it's TIE. And the reason I mention it is Ben has said at least twice today, or was it 3 times today, Ben? Isn't it time to implement? So this, it's very interesting that the barriers for interprofessional education and collaborative practice are pretty similar to the barriers of how do we fold in the non-pharmacological approaches to the treatment of pain. So does anyone know the acronym? Neil is a plant, just in the event no one did, just to kind of keep this going. Neil?
It's turf battles, ignorance, and economics.
Yes. So I think when you truly look at the barriers, it's pretty good, Ty, right? So interprofessional education, or education, really looks at addressing the issue of ignorance.
Yeah, I thought you were going to say training for interdisciplinary education.
That's pretty good, too. Yeah, we could use that, but we actually were looking at the barriers, so we thought that we would do this. So the main thing I want to bring out with our overall objective is that when we say within and across health professions, basically we are referring to interprofessional education and collaborative practice. And I think many of you have heard of it. It's IPECP. It's now required that all health professionals in mainstream conventional healthcare are trained in interprofessional education and collaborative practice. So I think that also when we look at chronic pain, or individuals who are talking today about acute pain, or individuals who are talking about cancer-related pain, one of the things we find that frequently the best kind of care, the most successful care, is truly team-based team-based care. So one of our other statements that we often use when we're referring to interprofessional education and collaborative practice is our goal is to create inclusive, truly collaborative, team-based, patient-centered care. That's kind of long, but I think when you put together everything we've been talking about today in terms of pain, that's often the best way to approach it. We've been very pleased here, many of us I've been talking to, that this workshop is so inclusive. And so it's not only what we tend to call mainstream and conventional medicine and health, but it's also what is now being referred to as complementary and integrative health. Used to be called CAM, and then it was called complementary and integrative health. But there's one distinguishing element I would like to bring out in this, which again is a bit of an educational element. So 5 of what we call the CIH are actually licensed, and they have accreditation bodies recognized by the U.S. Department of Ed. They have councils of colleges, and they have certification agencies. So I've been hearing a little bit of to whom do I refer, but when you are looking at the licensed practitioners, whether it be an acupuncturist, a chiropractor, a naturopath, a massage therapist, or a direct entry midwife, they all have licenses. And then some of the others, like some of the old traditional world medicines like yoga or Ayurvedic, very credible approaches, but they are not yet licensed in the U.S. So now what I want to shift to is giving you a brief overview of what we're going to be doing today, at the end of the day, and tomorrow. So today we are just going to be focusing on education, and still, even though IPE-CP is required, when you look at so many health profession educations, so many of the students are being trained in silos, right? I mean, we still see the silo is very predominant. We are starting to see some models where they're doing blended classrooms, which is where you put different health professionals in the same classroom. And we are seeing some examples of some actually really excellent collaborative clinics. So not only today does one need to actually gain the expertise in his or her own health profession, but they, in a sense, to really do within and across health professions and working together, they need to start to have a deep knowledge about the other health professionals, even if, whether it's in mainstream or whether it's in what we call CIH, complementary and integrative healthcare, and really look deeply at the philosophy, the training, the scope of practice, the degrees, and how they can be actually excellent members of the team. So what we'll be covering tomorrow, today is on education. So tomorrow we'll also be looking at the next steps of how can we improve training and education for pain management, specifically within and across health professions. And then we'll actually have some good examples of collaborative practice. So I'll talk about those more in the morning. I wanted to just spend a little bit of time giving you a slight history of how this has occurred in the U.S., and it's actually relatively new. I think many of you are familiar with the Lancet report on health professionals for a new century. It talks tremendously about the importance of working in teams, about being patient-centered, about being collaborative, about shared leadership. And it also talks about being willing to be a change agent. And again, we have an example of Ben standing up and saying, isn't it time to implement some of these areas that we've talked about now for several years. Another issue that I think is a really seminal article and is so relevant to professional teams is the future of nursing. And in that publication, what they talked about extensively is all health professionals should be in an environment where they can practice up to their full scope of training. And that's really not, in a sense, the current situation. I don't know if many of you know about the late Dr. Scott Reeves. He was one of the international leaders in interprofessional education and collaborative practice. And he pointed out the real importance of not having parallel practice, so you might be in a facility where you're all under the same roof, but how do you really practice as a team to offer patient-centered care? And particularly when you were looking at pain, but also in any other condition when you think about it, ideally if it's patient-centered, there's just going to be tremendous variation in how that individual is approached. So another very important time in our history of IPE-CP was the creation of IPEC. I think many of you are familiar with it. The Interprofessional Education Collaborative started with 6 of the mainstream health disciplines. It's now expanded to about 30 members. You can see there are 4 basic competencies, and under each one, there's a tremendous amount of sub-competencies. And at this point now that some of the CIH disciplines are part of IPEC and are supporting members of IPEC, and this is, in many ways, when you look at this, these core competencies could ideally be taught in blended classrooms. You can bring together a number of health professionals and have them actually be talking about these issues and sharing them and how they might work in their particular profession. I want to also point out that IPEC now does some really excellent training, and so does the University of Toronto and other areas as well, on how to actually work in and create teams. An area that we're seeing around interprofessional education is, while it's being taught to some of the next generation, there's still a shortage of faculty who are strong champions of this particular area, as well as clinicians. So I think, again, as we begin to move, the next generation is very interested in this team-based work, but we also need highly qualified faculty members to teach in this area. And the last element I want to mention is a national Academies. It used to be the IOM. Some of us were disappointed when it shifted because we've known it for quite a few years as the Institute of Medicine, but it was upgraded to the National Academies, and it created a global forum in innovations for health professional education. And initially we began really, I'm one of the early members in 2012. I think there are over 50 members now. Every health professional every health professional organization is at the table, and I think we represent 8 to 12 countries. So it's a real wide variety of health professions and organizations at the table. And we started in many ways due to the 2010 and 2011 elements that I've mentioned. But we also, not long after we began, started to cover important issues like the social determinants of health, as well as our very last one, focused on health and well-being. I think I've heard that mentioned only a few times today, but the importance of focusing on health and well-being and what we're hearing in terms of starting in preschool, or in starting in elementary school about good behavioral habits, and exercise and nutrition are so important. Oh, I do have one last one, and then I can see my red light blinking. Some of you may not know about the Nexus. It's out of the University of Minnesota. There's an enormous amount of information on their website. And Dr. Barbara Brandt, who's again one of the earliest, proponents and advocates for interprofessional education, is the lead there, and a good deal of the focus on why this was created to support interprofessional education and collaborative. You can see what's going on around the country in this particular area. And also what they're starting to find is that when you truly have strong interprofessional teams that are patient-centered, we're starting to notice that there can be a very significant reduction of medical errors. And iatrogenic deaths is not a small issue in the U.S. I'd also like to refer you to the Canadian consortium, with Dr. John Gilbert being one of the founders, and that started in the late 60s. So Canada has kind of set the pathway for us, and I'm delighted that we'll be having a speaker from there tomorrow.